Hello, we are here on behalf of CHI Health Nebraska to talk about our proposal for patient transfer scales. Throughout this proposal, please keep in mind that we ask the community to be fast when it comes to stroke. So in the hospital, we need to be fast in diagnosing and treating their stroke.
Every second counts. 1.9 million brain cells die every minute. Surviving a stroke with no deficits decreases by 15% for every 30-minute delay. The ischemic brain ages 3.6 years every hour without treatment. The IV thrombolytic dose given to patients suffering an ischemic stroke is calculated based on the patient's actual weight. The American Heart Association and American Stroke Association published target phase 3 goals to help assist with rapidly identifying and treating patients having a stroke. Rapid IV thrombolytic therapy improves neurological and long-term functional outcomes in acute ischemic stroke. To expedite diagnosis and treatment, our EMS partners communicate a pre-hospital stroke alert notification. This allows for our stroke alert process to begin before the patient even arrives. The patient, upon arrival, will go directly to the CT scanner without stopping in the emergency department and obtain immediate imaging. However, at this point, we do not have our weight yet. Having a weight prior to obtaining the images would allow for the pharmacist to begin their dose calculation and be prepared to mix and deliver the medication to the nurse for administration. Stroke can happen to anyone. It could be your mother, your father, your brother or sister, your wife, husband, or even your children. It does not discriminate. The average age of our patients diagnosed with an acute ischemic stroke who are also treated with an IV thrombolytic is decreasing.
Stroke is the leading cause of adult serious long-term disability worldwide, and delayed treatment has significant impacts. Stats show that 40% of stroke survivors require some kind of special care, 25% experience significant cognitive decline, and 17% on average will be discharged into a long-term care facility. And as you heard on the previous slide, unfortunately, the age of those individuals being impacted by this is decreasing. You've learned that time is brain, and so the AHA-ASA has set goals to administer this IV thrombolytic within 30 minutes. And in 2021, our CHI Health Midwest Division has a combined mean door-to-needle time of 47 minutes. So this patient transfer scale would help reduce thrombolytic administration delays and save more brain. In terms of feasibility, the patient transfer scale is lightweight at only 25 pounds, so it's easily portable, and it is operated by a rechargeable battery and can weigh patients up to 550 pounds. Each patient transfer scale costs around $4,000. In terms of its sustainability, it does have a 2-year limited warranty and is reusable and only needs wiped down with our approved antiseptic wipes between patients. It can be stored on the wall near a plug socket, so will be kept out of harm's way when not needed. And the plug has a magnetic connector at the end of the cable, so when pulled off the wall quickly, it will not damage anything. In terms of scalability, after implementing the patient transfer scale at our CHI certified centers, our hope is to expand this method to our critical access hospitals in order to share and promote rapid stroke workflows across the state.
Please consider our proposal. Save time, save brain, and improve outcomes.
Thank you.
Thank you.